Beginning this week's Cardiology Countdown is a paper published in JACC that looks at the potential mechanism of benefit of eplerenone, the aldosterone blockade agent used in heart failure. This was a study looking in the Ephesus trial at patients with LV dysfunction post-MI, where the benefit was linked to the diuretic effect and the potassium sparing effect. Each of these effects, measured by reductions in plasma volume or increases in potassium, were seen to be associated with better outcomes between 10 and 20%. But interestingly, there was no statistical interaction between these two, suggesting that the benefits are really independent of the diuretic effect, and therefore aldosterone blockade may be beneficial over and above any potential diuretic effect. The second paper we'll look at is published in Circulation, looking at the ever worrisome effect of statins on intracranial hemorrhage, something that people worry about as one of the side effects. This group of investigators looked at 23 randomized trials and 19 observational studies, about equally split between case control and observational studies. Interestingly, in the case control studies, they found a suggested benefit of statins on intracranial hemorrhage, but more importantly, from the randomized trials, there was no statistically significant increase in the risk of intracranial hemorrhage. So on the one hand, suggesting the benefits of randomized trials, but secondly, providing reassurance that intracranial hemorrhage is not one of the worries with statin use. And at this week's number one pick is a study looking at the predictors of stent thrombosis, incorporating both clinical factors and genetic factors. This is published in JAMA, is a case control study where genotyping was done and 3 genes were found, notably including the 2C19 gene, which has been widely studied. 2 other factors, interestingly, came out, including a higher loading dose associated with a lower rate of stent thrombosis, and interestingly, use of proton pump inhibitors associated with a higher risk of stent thrombosis, a controversial association not seen in the randomized trials. Now, there will be additional studies looking at options of reducing stent thrombosis with more potent maintenance doses of clopidogrel at the late-breaking clinical trials at the AHA, and other more potent agents also as a potential option for reducing stent thrombosis. So with this week's Cardiology Countdown, I'm Chris Cannon.